remember when we talk about marketing, and a lot of people get, all these words confused. Marketing is everything you do. So that's the big umbrella marketing. That's they say the 5 P's of marketing, your promotion, whatever it is, your product or services, your people, your place, your price, things of that nature. So that's, in other words, it's everything. Marketing is everything. Now, when you come over to one of those P's, it's called promotions. So promotions is divided into some subcategories, and within promotions, essentially there's publicity, there's advertising, and then there's sales. But if you wanted to kind of stretch it out a little bit more, there's publicity, there's 2 types of advertising, name recognition versus direct response advertising. Then there's sales promotions, and then there's sales, educational sales. Okay, so that if you wanted to stretch it out, that's kind of how it looks when we're targeting or going after a target market. Now, it all starts with the S-curve of economics and our target market. So if you recall, on the left side of the S-curve of economics are your target market that has a perceived need, and the right side does not have a perceived need, but that doesn't mean they don't need your services. It's kind of like chiropractic. On the right, there's only 8% of the patients who proactively look for chiropractors annually. So there's 92% that do not. But does that mean they don't have back pain, neck pain, or headaches? No, they do. They choose other routes. So advertising won't get those people. Educational sales is what is needed to get those people. And there is a difference. So we're specifically going to talk about advertising. And we're specifically talking about a target market who has a perceived need. In other words, they want your product or service. How can we get more of them versus your competition? So when we talk about personal injury patients and personal injury attorneys, remember when it comes to advertising, only 32% of personal injury patients utilize CAM providers, in a CAM provider's complementary alternative medical provider, and chiropractic is the highest category in CAM for personal injury. So it's less than 32% of personal injury patients that are looking for and accessing chiropractors annually. So that means 68% are not. So there's a large segment of the personal injury patient base that is not. And of course, what gets those people on the right side is the educational sales, not advertising. And the example I say with advertising, to simplify this, is if you want a fish sandwich and you're driving down the road. Let's say you're hungry and you want a fish sandwich and you're driving down the road and you see Arby's roast beef advertising the sign. You're not going to stop. That's not going to appeal to you because you're wanting a fish sandwich. But you're still hungry, so there's still a need. So it's the same kind of thing with the chiropractic patient or the personal injury attorney on that right side. So there's a large segment, the 68%. And remember, out of that 68%, 87% of them have a connective tissue problem. By far, the problem that chiropractors treat. So there's a large segment that's not looking for you. So it doesn't matter if you're advertising for fish or roast beef if they don't want fish or roast beef. So that's why we have to use educational sales, and we'll kind of combine advertising to increase their awareness, their interest, their need or desire. But that alone will not get the job done on the right side of that S-curve. So when we talk about advertising, we're only talking about the left side, whether it's a personal injury patient or a personal injury attorney. And remember, 75% of the personal injury attorneys are not proactive in their referring out and quarterbacking cases. So when we talk about advertising, it's a small number. Of the chiropractic patients, 8%. The personal injury patient, it's just under 32%. And the personal injury attorney, it's roughly under 25%. So advertising is a small segment of the potential. So we definitely want to know it, and we want to be aware of advertising and the principles of it, because the principles definitely go into educational sales, and we will use advertising combined with educational sales to access the right side of that S-curve. So just coming back to advertising. So when we talked about what is the formula to attack a target market, and we're going to define target market here in just a minute. But let's say there's a group of people that you want to attract, whatever category that is, whatever product or service you have. And the formula is to start with publicity. And the reason is publicity is considered third-party trust. It's there's higher trust in publicity because it's considered that somebody else is saying something good about you. And there's different forms of publicity that increase, and we use publicity to increase awareness and interest and authority. That's why we use publicity. Now, the two best things you could do for publicity, the number one thing is write a book. That's the absolute highest authority that you can be, is be the author of a book on that topic. That gives the highest trust and authority from a publicity standpoint. And be a speaker. Those are the two highest authority awareness things that you can do. So we do integrate those into the personal injury marketing plan. In our marketing plan, we do that. But also we'll use press releases. And we'll use press releases because they're much easier, effective, and efficient to create and produce and use. So a lot of times in our advertising campaign, especially with personal injury attorneys, we'll start with the press release to increase awareness and interest. And that's why. So what happens is when you look at that target market, and there's different degrees of people in that target market that have a need. Some people have real high need for your product or service. Well, let's face it, that's typically a real small percentage of any particular market. And if they have real high need, they're going to go to fulfill that need real fast. They're not going to wait around for you. They're going to go hunt and find it. So the target market that has a real high perceived need is generally very small, and it'll happen fast. And then there's the degree of need varies with the left side of the curve. And remember, we're always looking at the ratio of perceived need to obstacles. It's a relationship of need to obstacles divided by trust. What is the networking environment of trust that affects defenses and resistance and confidence relative to obstacles? So it's a total relationship in a target market of need to trust. So when somebody has higher need, their obstacles, you don't have to worry about their obstacles. The higher the need, the less you have to worry about and deal with obstacles. But you know, there's not large segments of people that have just huge high needs where you don't have to address any obstacles at all. That's very rare. Those are small segments of the market. And then as you go into the S curve, you'll see that there's definitely need. The need will come down. It won't be extremely high. But now the obstacles start to play a role. And the point gets to be when those two relationships invert. In other words, the perceived obstacles are higher than the perceived need. That's when the consumer does not act. And then you need to, we also need to pay a little bit more attention to educational sales, not just advertising. So those are the levers, so to speak, that we're paying attention to. Perceived need relative to obstacles. But now in advertising, the need's already there. So we're essentially going to use the subconscious communication to bring them through. And so here's how it would work. We would go after a target market. We would use publicity to get the low-hanging fruit. In other words, people that have higher perceived need, but that's a low segment of the market, or increase interest or awareness. Then from there, we would go into that target market with advertising. And remember, we're still going after people who have a perceived need greater than the obstacles. In other words, they are looking to purchase or act or refer or whatever. Move, in other words, move, act. So that's the advertising aspect of it. And now there's two different types of advertising, whether it's name recognition or direct response. And then also we need to pay attention to campaigns. What is the importance? What is the definition of a campaign relative to this whole formula? So that is very important, and we're going to make sure we spend a few minutes on understanding the value of a campaign versus just doing a one-off promotion. And those are two very big different facets. So let's go into, so if you took your target market and you came in with publicity, and then you came in with advertising, and then you're absorbing more of the people with the perceived need, and then typically that's followed by, remember, we're moving up the S curve, we're increasing the consumer utilization. So then we're going to go into advertising sales. So now what we'll do to get more of that target market, because remember the perceived need of these people are lower and lower as we go into the masses, into the market. There's less and less people with higher and higher perceived needs. So now after we've got a certain amount of the business from publicity, et cetera, a certain amount from advertising, remember we're trying to go into that S curve and maximize the fulfillment and get the majority of those people in that target market as consumers. So it starts with the publicity to get some in, the what we call the low hanging fruit, the easy ones, the high need. That's not a big number in markets. Then the advertising identifies the next segment to bring those in, and then from there there's less and less of a perceived need. So then we'll do sales promotions, and that's typically when there's offers. We're dealing with the obstacles, and typically that's when it's time and money type of promotions. So that's advertising sales. So now the key there is lower the obstacle. So now the key is, as we're going in, is lower the perceived obstacle to get more of the business. And really at that point, you're done with the left side of the S curve. You've kind of you probably or should have brought in your percent or share of people with higher needs or lower needs to definitely lower needs, where obstacles, specifically probably time and money, were more of an issue. That's the formula for the left side of the S curve to attack it and get into. Now, to pass that now, we now have to go into and deal not only with need, but also obstacles. And that's educational sales. That's the relationship. So again, we're talking about how to go into the masses from left to right of the S curve and get more and more potential business. So the educational sales, what's so important about that is, and that's a whole nother series, is establishing the need, and the need is admit consequences in the personalization. And remember, that's a relationship of need versus obstacles, and obstacles are kind of dependent on your target market. Most commonly, universally, it's time and money. Money almost always in anything, but it could be another factor. So you're dealing with perceived need relative. So it's admit consequences and personalization, with the consequences being pain-based motivation, because that's what motivates people out of the 5 reasons why we'll do something, from present pain to future pleasure to future curiosity to present future pleasure. So over 80% of why somebody will do something is to avoid present pain, and that's based on Maslow's hierarchy of needs of primary and secondary needs. So the sales component now, the educational sales component within that target market, incorporates the admit consequences and personalization, and it does it in a ratio of obstacles, hopefully enveloped in a communication of trust. And we're using trust to affect defenses, resistance, and confidence, and make them more susceptible or receptive to our message. So that's the formula to go into and saturate a market, and that's called the S curve of economics. And once that happens, typically it now leads to what's called the law of duality. The big guys eat the little guys. People go out of business, and you end up with 2 primary competitors: Pepsi, Coke, McDonald's, Burger King, and then there's a lot of little players. And now you're in the market share versus going to a whole new virgin territory, go overseas or someplace who doesn't have saturation with that product or service. So that's the cycle. That's the cycle of the S curve, and attacking it and going in. So let's go right into advertising specifically now. So the advertising that we want to make sure we're aware of, and there's 2 types of advertising. We talked about name recognition advertising versus direct response advertising. And then we talked about sales promotions, advertising sales promotions. And what's so important is to be aware of the two differences from a small business standpoint. Name recognition advertising is essentially, and they call that advertising for the generals, because it takes a lot of money to increase your name in somebody's mind. A small business owner does not have the money to do that. The average consumer is exposed to 5,000 to 7,000 impressions a day, and a small business owner just cannot create those kind of impressions that have top of mind awareness. And so a small business owner generally should not be going after um, um, name recognition advertising. You just won't have the money. I mean, it took millions and millions of dollars before anybody knew when they looked at a little swoosh sign that meant Nike and that meant sports shoes. So a lot of people bite the dust on that one. So we want to do everything we can to stay away from name recognition advertising. What's name recognition advertising? And that's just basically putting your name out there with no preference to a target market, essentially. And a classic example of name recognition advertising is, you're driving down the road and there's a billboard that says Budweiser. That's name recognition advertising. So what's the contrast to that? The contrast to that is the direct response advertising. And the small business owner has to do direct response advertising, and they have to be absolutely aware of direct response advertising. And these are the categories of direct response advertising. So we're talking about a target market, whatever your product or service is, whether it's a chiropractic patient, a personal injury patient, a personal injury attorney. There's always these segments in a target market relative to direct response. Number one is demographics. Number two is psychographics. Number three is psychographic barriers. Then there's geographics. Those are the four big ones. And then there's vehicle of delivery. What is the highest form of communication that target market will interact with? And then there's the US, then we actually get into the actual formula. But that is how we use direct response advertising. So, and a couple major issues relative to this is when we look at these categories, these are segmentation categories. And when we look at these categories, we're going to base it on the 80-20 principle. Now that's Pareto's law, and it's a principle. And basically what it says is, a majority can have an influence on a minority. In other words, we're not going to chase the minors. And you can't chase the minors in a brick and mortar business, generally speaking. And here's why. If you deviate from that 80-20 rule, so if we look at a bell curve relative to any of these topics, demographics, psychographics, geographics, and we take the sweet spot, in other words, where's the highest probability demographically of our target market, and we want to pay attention to the sweet spot because the further off you go, there's a smaller segment of the market, so there's less and less people. And it happens fast. It's not a linear curve. It's a bell curve. So really quick, when you start going off, those numbers become very small. And the reason this is so important from a brick and mortar standpoint, when you're a professional, a doctor, lawyer, and things like that, is you are limited by geographics. Now, if you're on the internet, you can take 1% of a market or 0.5% of a segment of a market, and out of all the people on the planet, that could be a overwhelming amount of business. But you take 1% of a target market and your geographic radius of draw is 2 miles, and you're going to be in trouble probably, especially in chiropractic. If there's 8% utilization, and let's say your geographic draw is 2 miles based on the 80-20 rule, and you now pick a segment of the market to go into, that's 1%. And a classic example of that are these chiropractors that try to treat asthma and allergies and bedwetting and all that. Well, those aren't gateways, number one, but the number of people that have that who are willing to go to a chiropractor, who are looking, in other words, what percentage of 8%? Well, that's 1% of 8%. That's a very, very small number. Well, how many of those people are going to be in a 2-mile radius? That's a very, very small number. You probably won't even be able to pay your bills on that number alone. So that's why we have to pay attention to this 80-20 principle within these target markets. So as we come down, let's go ahead and define these a little clearer. So as we define demographics from a population base most people are familiar with. It has to deal with age, sex, age, gender, familiarity, marital status, number of occupation, income. There's about 7 generally considered demographic profiles. Well, each one of those categories, there's a higher preferential likelihood of you getting that business. So demographics tells you who, and let me just I'll try to give a few examples as we come through here, to target markets. So when we look at let's look at gender for a second. If we looked at the chiropractic market, gender versus, let's just say chiropractic. Well, females outnumber males for a target market for chiropractic. So I know there's going to be my target market's I'm going to base it on females more. Let's go to age for just a second. Well, the target market for chiropractic patients for an age would be the sweet spot is like 30 to 55 is like the sweet spot. And when you start deviating, but if you go to personal injury cases, personal injury, the highest sweet spot for personal injury cases is 18 to 25. And so if you live near a university, within a geographic range of a university, those are great opportunities for marketing to personal injury potential patients. There's a high probability in that segment of the market. So these are just some examples of paying attention to demographics. Same with the attorneys. So the attorneys can vary also. The attorneys, when you look at demographically, typically some of the major factors we're going to pay attention to is we go after the second tier attorneys. So the second tier attorney, and some of the major characteristics are they're not the attorneys who are on radio and TV everywhere. There's typically owner operated. Typically it's them in their office. Typically they don't have a paralegal. Typically the paralegal shared by 2 or 3 other combined. And typically there's they're advertising other things, not just personal injury, divorce, bankruptcy, personal injury. So these are some of the demographic profiles. And then when we look at psychographics, of course, the psychographics is lifestyles, attitudes, and beliefs. Well, in chiropractic, that's actually divided into 65 different segments, 9 different major categories, 65 different subcategories. So when we open a chiropractic office, we pay a lot of attention to psychographics. And again, psychographics is lifestyles, attitudes, and beliefs. So I want to know that I'm in a sweet spot of people who naturally accept and will use and believe in chiropractic within that radius of draw, that geographic radius of draw. And so it's very easy to do research to find out who that is, and then check that geographic area where you're at to find out if there's a high probability of psychographically those people. And this is exactly how franchises open businesses and multiple businesses without even having to go there. All this data is just reverse engineered. They know who the sweet spots are for their target market. So then, of course, you have the geographics. That's the radius of draw. And that varies. The denser the population and the less further somebody was willing to draw for a product or service. And all products and services are different depending on the amount of information, the complexity, the difficulty of getting to it. So there's multiple factors. So just because you're a chiropractor doesn't mean you have the same geographic rules as dentists. So or especially attorneys. Attorneys will have a much larger radius of draw because you only have to see them maybe once. And a lot of times attorneys, you don't even have to see them now. You go online. So they really have expanded. Well, you have to physically go to a chiropractor. So the radius of draw is much smaller. So that's typically why in the geographics in an inner city, you might have 1 mile. In a suburb, it might be 2 miles, no more than 3 for sure. In a rural area, it might be 7 miles. So that's the examples we're using there. And so then we talked about the psychographic barriers, and those are unconscious perception beliefs of why people will or won't go into a particular area. And some of the common factors there are people are will more likely go in toward their economic hub than away. There's more resistance because they don't routinely go away. So their perception is it's much further. Lakes, railroads, large land masses, these are psychographic barriers. Typically in a town, you'll see a river or an industrial park or you'll see a psychographic barrier kind of dividing a town, depending on how big the town is. And then, of course, we're going to pay attention to the vehicle of delivery. And of course, the vehicle of delivery is how they receive information. And really what's important about that is multisensory. We want to make sure that their vehicle of delivery is, and the more that we want to be obviously in the vehicle of delivery of how they communicate. If your target market communicates very specifically by phone, then we're going to be paying attention to phone as the 80-20 rule. But we also are going to pay attention to the multisensory effect of that. In other words, we're going to pay attention to using the combination thereof, So we may use phone, fax, etc. Okay, in combination, because all of those, when combined, will affect the awareness. They'll affect the awareness. So moving through here, those are some of the major factors that we're going to consider for a target market, and then obviously the USP, the unique segment position. We want to make sure that we're saying the right thing. Now, when we do the advertising, and I should have stated this right at the top, is we use, for advertising, we're going to use emotion to get them in. So emotion is what gets people to act, so that's what we're going to use in our advertising. We're going to use emotion to get them to act, and what gets people to stay or repeat the purchase or justify the purchase is cognitive. So we're going to cognitively communicate with them once they've come in, but to get them to come in, we're going to talk to them on an emotional level. And when we talk about the emotional level, we're talking about specifically Maslow's hierarchy of needs, the pain versus pleasure-based needs, specifically more of the pain. So these are some of the major factors that we're going to take into consideration. So let's move through here, and then we're going to pay attention to why people buy. So when we implement our advertising strategy, everything is reverse engineered. Who goes where and why, and based on that, that's exactly what we do with our strategy. So we talked about the 5 reasons why people will buy after there's a perceived need. And they're generally different for every category of business, but number one in every business is always trust. So when there's a consumer that has a need, they'll typically go to their circle of influence and ask if they know of somebody. They'll ask for a referral. So in chiropractic, it's no different. And that's why it's very important to have a marketing system in place for your existing patient base, not only for when they have a problem again, but when their circle of influence has a problem or has a need. You are on the high state of awareness and consciousness to get that business also, because that's the first place they go. So that's the first place. You need to have a really good system in place. So number 2 is proximity. So in chiropractic, it's proximity because it's a brick and mortar based business. 3 is price. Price is always a factor if you're on their insurance or plan. Number 4 and 5 is service factors and quality factors. And those represent 3%. And 75% of the reason why somebody will go to a chiropractor outside of referral is location. Are you in their backyard? So we're going to make sure we pay attention to that with our target market and in our marketing. The last one is service and quality. Well, they kind of expect you. It's only 3%. Doesn't carry much weight at all. So we're not going to say a whole lot about service or quality factors because you're a professional from a chiropractic patient standpoint. Because you're a professional and you're licensed, so they assume you're regulated by the state and you wouldn't be licensed if you didn't give a decent service or quality. So that's just a perception. So those are the major factors relative that we're going to pay attention to the advertising for putting our advertising campaign together. And I'll kind of touch through some of these. Now we go into the formula. Well, when we go into the vehicle of delivery, we want to try to make sure when we have our target market that we're dealing with more of introductions. So the vehicle of delivery is really the introductions, active referrals, passive referrals, leads, and cold calls. And there's a higher percentage. You can get as much as 75% of business from an introduction in advertising versus maybe 55% from a referral versus only like 15% from a lead to only 1% from a cold call. So we're going to try to do everything we can to do introduction, active, passive referrals because we have a much higher likelihood of the advertising or marketing working. And it's because two main factors, trust and need. The chances are if there's an introduction, active, passive referral, there is a need for your product or service. And there's already to some degree trust. So their defenses and resistance are down and their trust is a little higher. So that's why we're always going to make sure we maximize the primary places they go first, especially in trust and active and passive referral categories. That's why our advertising is positioned. And of course, how we position it is going to be emotional and it's going to be pain based. And that's why we use what we do and how we use it. And then in the advertising, the formula is identifying the problem. Well, the problem should be the gateway. In other words, it should not be a paradigm shift relative to your product or service. It is the reason that they do see coming to you. So it's identifying the problem in the advertising and then you being the solution. And then the why you has to do with endorsements and testimonials, and that's third-party trust. And that is very big. And then we want to pay attention to offers, and offers help to lower the bar of the obstacle. So we're using the advertising to identify the problem, give the solution, create some third-party trust, and then the offer could either be a discount or a benefit or a combination thereof. One of the offers that we like to use with the personal injury attorneys is call for a review, a financial driver case review. In other words, you're willing to evaluate one of their cases to see if whatever doctors they've had are actually including in their notes all the potential financial drivers for that case, or that attorney's going to lose out. So that's the offer that we like to use. It's the financial driver case review. And then typically also we like limits. And again, we're just working on the human nature of limits. Anytime you pose a limit on something, it increases the person's ability to, or likelihood to act. And when there's a limited amount, stop. Because remember, the longer they wait, remember, perceived need decreases 50% every 24 hours. So time is not on your side by doing advertising and then waiting. It is on your side, though, with follow-up. So the offer is going to either be a discount or a benefit or a combination with a limited amount, and then a deadline. So these things are all incorporated, or to some degree, to establish the problem, give the solution, create the trust, give limitations with an offer and a benefit, and get them act now. So those are all the components relative to the advertising formula. So specifically, what we pay attention to are campaigns. In other words, we don't want to just do a one-off. Remember, there's 5,000 to 7,000 images that are coming across people every day. So what is important are campaigns. And so what's the difference of a campaign versus an advertising promotion? Well, a campaign does multiple things. A campaign has multiple follow-ups. And there's many byproducts to a campaign. First of all, when you have a target market and you have a campaign, in other words, there's regular follow-ups in some form or fashion, the byproduct is trust and confidence goes up just because the multiple contacts and defenses and resistance go down. So that's one benefit of a campaign versus doing one advertising piece and being done. The second one is the campaign is used to reinforce the emotional triggers. It's used to reinforce the emotional triggers. So in a campaign, we may use many emotional triggers in that campaign, not just one. And remember, that's why they buy. We buy emotionally and justify intellectually or cognitively. So that's why when we do personal injury attorney, their campaigns, they're advertising campaigns. It's not a one-off and done. So that's why we would start with maybe a publicity, one or two press releases to increase awareness, interest, etc. From there, go into the advertising, and within the advertising, of course, we have the specific offer that's a pain-based loss or relevant to that person. But we'll also try to incorporate an letter of introduction to somehow create some social proof and trust within the category. And that's also why we'll also include an offer. So we identify the problem, give the solution, and identify a limited benefit offer of the financial case evaluation drivers to see if they've been included or maximized out in that particular case. So these are all components that we're paying attention to relative to a campaign. Say a campaign would have in that example of the personal injury attorney marketing, would have, one or two or three press releases to the target market. Then it would have the advertising to the target market, and then it would have the follow-up to the target market. And the follow-up is affecting all these things with trust, defenses, awareness, as well as continuing to hit the emotional button. So that's the difference of a campaign relative to your advertising. So we're trying to affect the emotional buttons as well as incorporate some type of offer, deadline, limitation, etc. So that's the difference with a campaign. So these are the major factors. And so let me just do a quick walkthrough of some of the major categories, and I'll include a whole list. But that's why in advertising, if you look at your target market, like the personal injury patient, the first place they'll do is turn to their circle of influence. So that is why we have a video newsletter that'll go to them. That's why we like doing video. That's why it's like it to be personal, emotional. We'd like to have a paper every now and then, every 3 months, something like that. Also, because now it's a different vehicle of delivery, so it magnifies when you have two pieces coming from two different sources. It heightens the awareness. It has a synergistic effect as opposed to two pieces coming from one source. So that's why periodically we'd like to send that. And of course, the content stays totally relevant to your target market's need. And then also, so that's why we do that. And that's also like why we like to do the webcam when the doctor shoots a webcam and sends it out to the patient base periodically. It's visual, it's very personal, it's emotional, it's repetitive, and of course it's informative. There's a bit of information relative to that target market, the personal injury target market, and where they can go to get more information relative to that. So that's why that is very specific to your marketing plan for that category, which is the first place they go, their circle of influence. And then we talked about the next place that they'll go is typically to the internet, and they'll check for their insurance companies, and that's why we like to have all the videos with the insurance companies. So when they Google their insurance company for your area, those videos come up. And typically after that, if we're talking about still just the personal injury patient, they'll Google their condition. That's why we like to have their conditions up. Or if they do know they want a provider and they're looking, then we want to make sure that we are in the provider location, chiropractor your location. And then also the personal injury words, the treatment therapy words with, accident, injury, accident, injury, personal injury, car injury, auto injury, whiplash injury. So when they Google those various words with proactive word, a proactive word is relief therapy or treatment. In other words, if they're Googling relief therapy or treatment in your location, they're looking to do something. So we make sure we have those covered, as well as your doctor keywords and the various combinations of doctor, from chiropractor, clinic, to center, to doctor, to MD, medical doctor, doctor spelled out, long form, doctor, DR short form, physician. So we make sure we have those covered with the injury-related words, such as injury or accident injury or car injury or auto injury or whiplash injury or personal injury relative to the doctor words. So that's all called advertising. Somebody who's looking and being there for them with the right solution to their specific problem with the call to action. So these are just some of the advertising categories that we're talking about. So again, in summary, when we're talking about advertising, we're being very specific to the people who are looking to capture them, or we will use advertising in conjunction with publicity to actually go into the sales category to affect awareness, interest, desire, and so we can position ourselves for the educational sales. And that's when we have to go in and take that target market, do the admit consequences and personalization relative to the needs. So that is totally how to go into the S-curve of markets from left to right, from the low-hanging fruit to the high-hanging fruit into the masses.